Welcome to This Explainer. Look, if you or someone you care about is facing the prospect of stopping opioid use, I know exactly how terrifying that can feel. The anxiety of the unknown, the sheer fear of the pain, it's all completely valid. But here is the absolutely crucial thing you need to know right up front. Opioid withdrawal, while genuinely frightening and definitely uncomfortable, is an entirely manageable medical process. It literally doesn't have to mean suffering through days of agony alone in a dark room. So today we're going to look objectively at the science of what happens in the body, demystify the symptoms, and chart a clear, medically supported path to recovery.
Okay, let's dive into this roadmap. First, we'll cover understanding opioid withdrawal, then the physical and psychological toll, followed by the withdrawal timeline. After that, we'll hit why medical detox matters, the iRely recovery approach, and finally, life after detox treatment. Step by step, we are going to demystify this entire process.
All right. Section 1. Understanding opioid withdrawal, the body's recalibration. Let's jump right into the fundamental mechanics of what actually happens in your body when regular opioid use suddenly stops.
So, taking away all the stigma for a second, opioid withdrawal is purely a physiological reality. Basically, your body and your nervous system have adapted to the constant presence of opioids. When those drugs are suddenly taken away, your nervous system essentially goes into overdrive. It gets hyperactive. It is absolutely not a moral failing, right? It's literally just your nervous system attempting this massive, temporary recalibration to adapt to the drug being gone.
Now you might be wondering, and this is a massive looming fear that keeps so many people from getting help, can opioid withdrawal actually kill you? Let's address that head on. The short answer is no. Uncomplicated withdrawal is not life-threatening. You might feel totally miserable, but it won't kill you. However, and this is a really big however, complications can pop up if you have underlying heart conditions, seizure disorders, or if you get severely dehydrated. And that is exactly why going through this without medical supervision is incredibly risky.
Moving on to Section 2. The physical and psychological toll, what to expect. Knowing what's coming is half the battle, so let's look at the specific realities of these symptoms.
And this brilliantly illustrates how withdrawal is essentially a dual-front battle. It attacks the body and the mind simultaneously. On the physical side, you're looking at intense, flu-like symptoms. We're talking severe body aches, sweating, nausea, and insomnia. But look over at the psychological side. This is equally, if not more, brutal. Severe anxiety, intense cravings, just deep restlessness. It's an exhausting combination, which is why willpower alone is almost never enough.
To really grasp the psychological toll, we have to look at your brain chemistry. During withdrawal, your brain is struggling with severely depleted dopamine levels. Think of it like your emotional regulation systems are running on an empty battery and have just been taken offline. This leads to profound depression and something called anhedonia, where absolutely nothing feels pleasurable or worth doing. If you or a loved one hits this deep despair during withdrawal, please understand it's a temporary medical data point. It's just brain chemistry, not a permanent reality.
Okay, Section 3, the withdrawal timeline, mapping the journey. One of the most terrifying things about withdrawal is feeling like it's never gonna end. So knowing the timeline is absolutely crucial for dialing down that anxiety.
Let's move to and see how this builds chronologically. It's actually incredible how fast the body reacts. For short-acting opioids, symptoms kick in within a staggering 6 to 12 hours. For long-acting ones, it's about 24 to 48 hours. But notice where this escalates. Days 3 to 5. This is when the acute symptoms peak. After that 5 to 10-day window, the intense physical agony drops off, and you move into a prolonged phase of fatigue and sleep issues that can last a few weeks.
I really want to validate how intense those middle days are. That peak period of days 3 to 5 is absolutely brutal. And let's be totally honest here. This is exactly when most people who try to quit at home end up restarting. They aren't restarting because they want to get high. They do it simply to stop the profound agony. Seeing this timeline really highlights the absolute necessity for medical intervention.
Which naturally brings us to Section 4, why medical detox matters, a safer path. This is the most hopeful part of our explainer, because there's a clinical, evidence-based solution to that brutal peak period.
When we put these two approaches side by side, the choice is crystal clear. Home detox,
just going cold turkey, practically guarantees intense suffering and a massive relapse risk. But medical detox totally flips the script. By using FDA-approved medications and continuous clinical monitoring, we can dramatically reduce both the symptoms and the cravings. Basically, medical supervision turns an agonizing trial into a manageable, comfortable, and successful process.
So the crucial point is how this medical magic actually works, and that's through medication-assisted treatment, or MET. It's the gold standard in addiction medicine. Medications like buprenorphine scientifically bind to the exact same opioid receptors in your brain that the drugs did, but, and here's the kicker, without the euphoric high. They just stabilize your brain chemistry. That means you can actually sleep, eat, and function without the agony.
Now, I hear this myth constantly, so let's debunk it right now. No, you are not just trading one addiction for another. MAT manages a severe substance use disorder medically, in the same way insulin manages diabetes. Because these medications stabilize brain chemistry without causing intoxication, patients can actually rebuild their lives, keep their jobs, and repair relationships. It's all about getting back to a normal, productive life.
All right, Section 5, the iRely recovery approach, real-time care. So where do you go to get this level of care? Let's take a look at iRely Recovery, which is a specialized facility that actually puts these gold standard detox protocols into practice. When you are facing withdrawal, speed is absolutely everything. You don't have days to sit around filling out paperwork. iRely's process is super rapid. Step 1 is just a simple phone call for rapid triage. Step 2 is immediate stabilization, meaning a phone-to-bed admission with no waiting lists while your symptoms are spiking. And Step 3 is real-time medication adjustment to keep you comfortable the second you walk through the doors. Now, what's really interesting about this slide is the sheer level of medical precision happening behind the scenes. iRely doesn't just hand you a pill and point you to a room. They use hourly symptom monitoring. You've literally got an elite UCLA addiction psychiatrist and 24/7 licensed nurses measuring your symptoms in real time. That lets them adjust your comfort meds in minutes, not days, all within a highly compassionate, trauma-informed environment.
Section 6, Life After Detox Treatment, Sustaining Recovery. Getting the opioids out of your system safely is a huge victory, for sure. But detox is really just the first step in a much larger, incredibly hopeful journey. 28 to 90. That is the typical number of days patients spend in iRely Recovery's clinically managed, high-intensity residential treatment. Once that acute physical crisis of detox is handled, this 28 to 90-day window is where the real psychological healing and intensive therapy kick in, building the actual foundation for long-term sobriety.
And part of that long-term healing is getting ready for post-acute withdrawal syndrome, or PAWS. This is that lingering phase of fatigue, depression, and poor sleep that can stick around for weeks or even months. What's great is iRely specifically educates and prepares patients for PAWS before discharge. They equip you with cognitive behavioral therapy and coping strategies so you aren't completely blindsided when these symptoms pop up later.
The distinction here is super important. Detoxification takes days and focuses purely on safe stabilization of those acute physical symptoms. Comprehensive treatment, though, takes months. It dives into the underlying psychological factors with the ultimate goal of preventing relapse and building recovery skills for life. You absolutely need both to truly overcome a substance use disorder.
If this kind of structured, medically supervised approach sounds like what you or a loved one needs, here are the logistics. iRely Recovery is at 1754 Nava Street in Sherwood Forest, California. They take most major insurance on an out-of-network basis, and they offer a full continuum of care, so you can transition seamlessly from residential treatment right into outpatient continuing care.
Okay, I want to give you a concrete takeaway. If you remember nothing else from this explainer, save this number, 818-262-3537. That's the direct line to the admissions intake team. You don't have to wait for the withdrawal to start to make the call. Actually calling before the acute symptoms peak is the absolute best way to prevent the worst of the suffering and get rapid triage rolling immediately.
So, what does this all mean? We've covered the science, the timeline, and the medical solutions. The path forward is mapped out and there is real medical support available. The only thing left is the hardest but most important step. Are you ready to stop suffering alone? Medical intervention is out there waiting to change the trajectory of your life. Reach out, make the call, and take that first guided step toward lasting recovery today.